there's a couple of things that are specific or particular to the senior horse category, and when it comes to parasites. Generally, we find when we do large studies and surveys of large populations of horses that the senior horses, that's the group that's the least likely to have parasitics in their fecal samples. They have the lowest counts and the largest proportion of zeros overall. So a senior horse is typically a horse that doesn't have a lot of parasite infections. However, senior horses can also have other health issues that I'm sure many of you are aware of. There are some endocrine disorders, some metabolic conditions, and just like the high age, that can all lower or suppress the immune status of the horse, and that can also affect the parasite burden. So in horses with PPID, which is one of the well-known conditions that senior horses can have, we've shown that those tend to have higher Strongyle parasite egg counts. Doesn't necessarily mean they have more parasites, but it means that they're high shedders, which means that they contribute more to the overall infection pressure within that herd. So there's a reason there to be more focused on your senior horses and make sure you get them tested regularly. We've also shown recently that some of these metabolic conditions that horses can have when they get older can also somewhat interfere with the efficacy of the anthelmintic treatment of the deworming. Not necessarily a whole lot, but it seems like the response to the treatment can be a little bit less effective compared to horses that don't have some of these conditions, particularly insulin dysregulation, which is one of the conditions that we see in senior horses. So there's a couple of reasons to just be extra careful with your senior horses. Typically they're strong. Typically they have a very strong immune response to the parasites, and they've been exposed their entire lives. But sometimes there are these specific conditions that can interfere with both the egg count level and also, to some extent, maybe also the treatment efficacy. How should you deworm your senior horse? You should essentially approach it like you do any other horse. It's not like you have to do something very different to your senior horse than you do to your other horses, but as discussed, senior horses can sometimes be more likely to be in the high Strongyle egg shedding category. And when we talk about high shedders, those are the horses that we sometimes want to treat a little bit more over the course of the grazing season than we do with horses that have very low egg count. In the parasite control guidelines that we've just published, we operate with a two-pronged or two-tiered approach where we define a baseline of treatments that should be considered for all horses, and then we build on top of that based on what we find in our fecal samples. So if we find out that a horse is a high shedder, that horse needs to get additional treatments in addition to that baseline that we define for all horses. And sometimes your senior horse could be in that category. So it's important to monitor the fecal egg count levels in the horse over the course of the grazing season and from one year to the next. Sometimes we see it change once they start gaining a little bit higher age. So there's just particular reason to be a little bit more attentive to your senior horse. But the dewormers that we choose are the same. The risks of drug resistance are the same. They share the parasites with the other herd members the same. So it's not like they get different parasites necessarily.